Today's menMD Real Talk webinar, the Vacuum Erection Device Online Clinic. My name is Austin Hunt, and I'll be your moderator for this event. I work on the marketing team here at menMD, and I'm excited to be hosting this session today. Before we get started, we have a short disclaimer that we need to review.
The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
All right, with that being noted, I'm pleased to introduce today's presenter, Patrick Carpenter. Patrick is a pharmacist located in Portland, Oregon, who specializes in erectile dysfunction, men's sexual health, drug relations, and pharmacy compounding. Today he's going to cover VED device assembly, penile reconditioning, VED use for sexual activity, penile rehabilitation for post-prostate treatment, and then hold a live Q&A to close out the webinar. But before I hand the mic over to Patrick, I have a few housekeeping items to cover about this presentation in the menMD Real Talk webinar platform. If you're joining on your laptop or desktop, you'll notice a control panel on the right side of your screen. If you'd like to minimize your control panel, click the orange arrow at the top left of your control panel. If you're joining on a mobile device, your controls are at the bottom of your screen. As an attendee of this webinar, you've joined in listen-only mode. If you have a question for our presenter, please feel free to send it through the Questions tab in the webinar control panel if you're joining through your laptop or desktop, or in the bottom tab if you're joining through your mobile device. We'll be answering questions at the end of the presentation, but if we don't get to your question today, we'll be sure to follow up afterwards. So without any further ado, I'd like to kick things off by welcoming our presenter. Patrick, over to you.
Thanks, Austin. Thanks, everyone, for joining us today. Let me go ahead and share my webcam so you can see me through all of this, and then we'll do some poll questions and get started with the presentation. Okay, so before we get into the erection process, let me ask you some poll questions so that I understand who's in attendance. The first question is, how long have you been experiencing erectile dysfunction? Okay, the majority of attendees, 66%, have said 3+ years. The next answer is 1 to 2 years. And then we have some people that are less than a year, a few that are 0 to 5 months, and some that are 6 to 11 months. So nice diversity in the crowd here, skewed towards more long-standing erectile dysfunction. Let's go on to the next question. Have you attempted to use a VED before? Okay, maybe about a 60-40 split. 57% have said yes, they've attempted to use a VED before. 43% of people have not. So we have a crowd that is skewed towards 3+ years with erectile dysfunction, but split about evenly, or more like 60-40 in terms of whether or not a VED has been used before. That's very interesting. I think we have one more. Have you attended a menMD Real Talk webinar before? So have you done a webinar like this, regardless of the content? Have you been on a menMD Real Talk webinar before? Please, yes or no. 70-30 about now. So 30% yes, 70% no. We'll go into the presentation then. My goal here is to spend about 20 minutes on the slides and talking you through this with some instructional videos and demos, and then we'll get into question and answer. All right, so the erection process. So the normal process for getting an erection is first your brain becomes aroused. You know, you have sexy thoughts, and that stimulates a series of nerves in your body and blood flow changes that lead to muscles in the penile artery becoming relaxed. There's smooth muscle relaxation, which increases blood flow into the penis, and that increased blood flow is what causes the erection, the stiffening, the rigidity of the penis. And then at the base of the penis, some veins, as the penis engorges, the veins tighten, stop venous outflow. So the process of getting and maintaining an erection is this delicate balance of blood flow in and out of the penis. We need both arterial inflow and we need restricted venous outflow in order to get and maintain an erection. And defects in each of those areas can lead to erectile dysfunction. One possible treatment for erectile dysfunction or for penile rehab, or what we're going to call penile reconditioning today, is a vacuum erection device. What is a vacuum erection device, or a VED? Well, it's an FDA-approved medical device. They've been in use since the 80s. How does it work? It's a hollow tube that you can see there in the picture that you place your penis inside of. You place the tube over your penis. And there's manual ones so that you pump, like a bicycle tire pump, or there's battery operated ones that run the vacuum for you to extract the air from the tube. If you're using the VED for sexual activity, there's a constriction loop that you'd put at the base of your penis to trap the blood flow in, because if you just use the VED to pull blood into the penis and you don't use the constriction loop, as soon as you take the VED off, you'll immediately lose the erection. So for the purposes of sexual activity, you use that constriction loop to mimic the tightening of the veins at the base of the penis that I just described in the natural erection process. For penile reconditioning, what I'm going to call throughout this presentation penile rehab, the constriction loop is typically not used. And then a very common question is, how effective is it? Well, a VED will produce an erection in over 90% of men. So it's a very, very effective process for getting an erection. Optimizing VED performance. What are the things you need to know going into this, since many of you have not used a VED, and even those of you that have, maybe you're not having optimal performance? The tips that I give patients for optimizing VED performance are very similar to if I was talking about another treatment modality like an injection therapy or any drug therapy, or really learning anything new in your life. It's about learning about what you're doing and having some patience with yourself and understanding that maybe the first time or the first few times things aren't going to be perfect. So this is an orthopedic device that's going to require some fitting and some adjustment and some practice. You know, first time you put your penis into the VED, the seal might not be perfect. You might not use enough lubricant on the tip of your penis, so maybe your penis is getting caught on the cylinder. Maybe you don't put the constriction loop on right the first time, or you use a constriction loop that's not the right size, so it's not tight enough, so you lose the erection. Again, if you're patient with yourself and you go into this with the understanding that there's a process, just like learning how to ride a bike, and eventually you're going to get it, you'll be more patient with yourself and be more successful. What are some other examples of orthopedic devices? You know, just to demystify this a little bit and make you more comfortable, a pair of glasses or a knee brace or crutches. These are all other examples of things that you may have needed to use in your life that you're not just comfortable with as soon as you put it on. You've got to play with it a little bit to get comfortable. So as I was just saying, the VED learning curve, you've got to set appropriate expectations. You've got to be patient with yourself. To master the VED, you've got to approach this with an open mind, willing to learn a new skill. If you're involving your partner, you'd want your partner to be supportive. You know, you've got to explain these things to your partner just like you're learning about it yourself. You want your partner to be supportive as you're going through this. Willingness to experiment, a commitment to learn how to use the device before attempting sexual intercourse. I would imagine that if you've unpacked the box and you've never used this and you don't know what you're doing, and the plan is to have a satisfying, fulfilling round of sexual intercourse that evening, that's putting a lot of pressure on you, on your partner, on the device, on your penis. So again, sort of patience will go a long way here. You want to focus on the goal, which is consistently creating your fullest natural erection in 1 to 3 minutes. If that's not what's happening, you want to keep practicing. And understanding that the amount of time that you've gone without getting a natural erection is going to influence sort of how effective this is and how quickly your penis rebounds and how much rehab you need. So the VED for penile reconditioning, we'll start by talking about penile rehab, and then towards the end of this, I'll show you a video about the VED for sexual intercourse. So we'll start with penile rehab. Well, what is penile rehab? It's a way to, it's sort of like physical therapy for your penis. So if you broke your ankle You would, the bones would be set, you'd wear a cast, and then after the cast comes off and the bones are healed, you don't go out and run a marathon. You go to physical therapy to do small movements and practice to regain range of motion in those muscles and strengthen those muscles so that you can ultimately go out and run. That's the same idea behind penile rehab. You're going to be reconditioning the smooth muscle and the veins and arteries in the penis with the hopes of being able to get and maintain an erection sufficient for intercourse. So VED penile rehab is recommended for men who have been sexually inactive or no longer experience nocturnal erections. Nocturnal erections is an erection at night. It's a normal process that you may still be happening to you, or certainly happened when you were younger. Throughout the process of sleeping through the night, you experience 3 to 5 natural erections. And that stretches the penile tissue, it oxygenates the penile tissue. You may wake up in the morning with an erection. That's a remnant of one of these nocturnal erections. Men with medical conditions that cause ED experience a loss of nocturnal erections. So the theory here is that we're going to get these erections during the day through this penile rehab that's going to sort of do the work that your body was naturally doing while you were sleeping with these nocturnal erections. And again, the theory is that these nocturnal erections are stimulating blood flow into the penis, they're stretching the tissue, they're oxygenating the tissue, and there's a therapeutic value associated with that. So that stops happening as we age, which is a natural part of aging. We want to sort of jumpstart this rehab or physical therapy for the penis, with the hope that it's going to allow you to get a stronger erection, or an erection on your own, or need a lower dose of medicine in order to get an erection. So how does it work? Well, you're going to use the VED 3 to 5 days a week for 20 to 30 minutes each time, without the constriction loop, without the tension ring, to mimic that nocturnal erection process. So in most cases, doing this for a period of 1 to 2 weeks is enough time to begin to recondition the penile tissue to get used to the stretching and accommodating that blood flow. Every man is different though, and more or less time may be required. And again, this is going to be dependent on your other medical conditions, your age, the amount of time since you last had an erection. So please just be patient with yourself. If there's one piece of advice I could give to every man that's experiencing erectile dysfunction, it's be patient with yourself. The problem didn't occur overnight. The solution may not occur overnight either. But with your patience and dedication, we can get you there. So what are the components of the VED? There's the pump head, the tension system loading cone, there's the cylinder, the inserts, the tension system, and the lubricant, and they're all numbered and pictured there. I don't need to belabor that point. You can see the pictures there, and the slides may be helpful along with the instructions as you put together your own device. So you start by assembling the VED. You want to line up the negative pressure pump head with the cylinder. Place the black inserts into the open end of the cylinder. This is the rubber ring that's going to go around, that your penis is going to go into, that's going to help create a seal. And you're going to turn the pump head to lock it onto the cylinder. This is just assembling the device. The next step is to lubricate the inside of the cylinder. Again, you need to create a tight seal around the base of your penis and that cylinder so that air doesn't escape. So the purpose of the lubricant there is to help create that seal. You want to spread the lube about 2 inches deep. This is partly because as you create the vacuum in that cylinder, some penile skin is going to be pulled up in there. You want to be sure to create a nice seal. You want to make sure that your skin isn't scraping on the sides of the cylinder. You want to also lubricate the head of the penis, as I mentioned. As your penis engorges and fills with blood, it's going to potentially drag along the interior surface of that cylinder. To make this not painful and to allow everything to happen smoothly, putting some lube around the head of the penis will help make sure that there's no discomfort as the penis swells and drags along the cylinder. You want to use enough lube to make sure that the penis doesn't stick, as I've said. Lubricate the rim of the cylinder. Again, this is going to help create a tight seal around the base of the penis. You then place the open end of the cylinder around the penis, or better said, put your penis inside the open end of the cylinder. Hold the cylinder gently against your body. The cylinder should point down towards the floor at an angle of about 45 degrees, just like you can see in that photo. You then operate the negative pressure pump head, whether it's manual or battery, whether you're depressing the plunger or pushing the button to start the electric vacuum. You want to use the pump handle 3 times, then wait 10 seconds, or if it's battery, press the button to activate the vacuum for 5 seconds, then wait 10 seconds. And you repeat this process over and over again until you get a full erection. Maybe the first time you don't even get a full erection, you just sort of try it out and get a semi-rigid erection and stop. That's okay too. What you don't want to do is just keep pumping and pumping and pumping with the expectation that you're continuously filling your penis, or keeping your finger on the button, running the pump to get a constant erection. You definitely want there to be some lag time between creating the vacuum and allowing the penis to engorge. That's because when you push the button or use the plunger, the vacuum is created and it takes a moment for the penile tissue to equalize. So there's going to potentially be a delay between your penis filling and the vacuum that's created in the cylinder. So you want to make sure we don't overstretch the penis. That's one of the big takeaways here is, it's really the only way you could hurt yourself is by overstretching the penis. So you want to give yourself time in between each of the depressions or each of the times you push the button. When you're done, after you've gone through however many cycles it takes to get the full erection, and you've sort of sat there with the erection for a minute, you would release by pushing the round black button on the pump head, and that's whether it's manual or electric. That's going to release the vacuum, and then you'll see the detumescence of the penis, the loss of the erection as the vacuum is gone. What guidelines do you need to be aware of or do you need to follow? Well, after the erection is created, you want to hold the erection in the cylinder for 1 to 3 minutes. This is to make sure that you're deriving the most value from the oxygenated blood and engorgement that has occurred in the penis. Release the erection in the cylinder while maintaining a seal. Sorry about that, folks. While maintaining a seal between the body and the device. Repeat the process 3 to 5 times for a total of 10 to 15 minutes per training session. So you go through that process of pumping, waiting 10 seconds, pumping some more, waiting 10 seconds. And again, that may take 5, 10, 20 times before you get what is for you a full erection. Then you sit with that erection for 1 to 3 minutes to allow the tissue again to be stretched and oxygenated. Then you release the vacuum and then you start again from the beginning. And you do that whole process 3 to 5 times for something that in total maybe 10, 15, 20 minutes, maybe even half an hour. That's what's going to allow you to get the most benefit from the penile rehab experience that we're describing here. Okay, VED for sexual intercourse. So we're going to shift gears now from that rapid overview we did on penile rehab, and now we're going to talk about what's a little bit different, which is using the VED for sexual intercourse, with the main difference being simply that you're going to use the tension ring. And rather than talk through that, I'm going to show you a video that's going to explain that. So bear with me while I get this video going.
To best understand how to use the system, it's helpful to see an actual demonstration.
Step 1. Loading the tension system. Place the loading cone into the bottom of the cylinder and place it on a flat surface such as a table or countertop. Lubricate the loading cone. Grasp the bulky part of the handles of the tension system and slide it down onto the cylinder, mounting it approximately 1/4 inch from the edge of the cylinder. Remove the loading cone. Insert the large comfort insert into the base of the cylinder. If necessary, insert the small comfort insert into the large comfort insert. Step 2. Assemble your system. Assemble your system by lining up the negative pressure device with the negative pressure cylinder. Give the negative pressure device a 1/4 inch turn to secure to the negative pressure cylinder. Do not over tighten. Step 3. The lubrication process. Lubricate the inside of the bottom of the cylinder generously up to 2 inches inside the cylinder. Lubricate the glands of the penis to ensure that during engorgement the penis will not stick to the sides of the cylinder. As if applying toothpaste, lubricate the rim of the cylinder and comfort insert with a generous bead of lubricant. Step 4. The application process. Apply the system over the penis with the system pointed down towards the floor at a 45-degree angle. Make sure that the penis is resting at the bottom of the cylinder. Give the system a twist back and forth to ensure that a good seal is created against the body. Do not press the cylinder too hard against the body. Begin operating the negative pressure device by pumping the handle 3 times. Wait 10 seconds to allow blood to flow into the penis. Continue this start and stop process until the penis has reached full engorgement and the penis has lifted from the bottom of the cylinder. Be careful not to create negative pressure too quickly or overpump. Step 5. Tension system transfer. Holding your hand as if making a C, push the tension system from the cylinder onto the base of the penis. To ensure correct application, please complete this step in one smooth motion, being careful to pull your scrotal tissue downward before transferring the tension system. Step 6. Removing the cylinder. To remove the cylinder, press the round black pressure release button. Once the pressure is released, remove the cylinder from the penis. Once you have removed the cylinder, you are now ready to begin sexual intercourse. Step 7. Terminate the erection. Grasp the tabs and pull evenly on both sides. Allow 10 seconds for blood to flow from the penis. Once the penis has become more flaccid, pull the tension system away from the body and off of the penis.
Okay, so as you saw in the video, the main difference, it walked you through everything that I did, the main difference being that at about the 2-minute and 30-second part, they talked about putting the tension ring around the base of the penis to stop venous outflow of the blood that was pulled into the penis. All right, who are the best candidates for a VED? Well, all men actively treating erectile dysfunction can benefit. The VED can be used to create and maintain erections for sexual intercourse. It can be used for penile reconditioning to maintain penile health. And, and these aren't mutually exclusive categories. You can be a man that wants to use the VED for sexual intercourse and still benefit from penile rehab. And just because you're engaging in penile rehab, most likely because your end game is to want to have sex. So although we review these as if they're sort of 2 separate buckets, most men typically fall into both. Or maybe you're using, another common scenario is you're using the VED just for penile rehab, and then you have some other modality, whether it's injections or pills to help you get an erection for sex. Men who report partial erections with oral medications or injection therapy can safely use the VED to achieve erections. So, that's talking about using the VED as an additive means to get an erection. So maybe your other medication is only getting you to, say, a 6 out of 10 on a rigidity scale, but you're looking for an 8 or a 9. You can use the VED to augment that. That's perfectly safe, and that's a very common question. It can be used following prostate cancer or prostatectomy, a medical procedure that can really be devastating to erectile function. It causes penile shortening, again, complete loss of erectile function for many, many months. And the best way to recover from a penile prostatectomy, prostate surgery, is to at the beginning engage in aggressive course of penile rehab. Those are the patients that have the best outcomes. And you can see a nice little quote down there from a journal article, which I won't read. It's been on the screen for everyone to see. What are the side effects? I mentioned during the talk that the main thing that we worry about is overinflating the penis. Another common side effect is if you haven't had prostate surgery and therefore you can still ejaculate, the constriction loop at the base of the penis could create enough tension on the urethra to stop the flow of ejaculate out of the penis. It can cause penile numbness, bruising, or discomfort. It's no different than putting a rubber band on your wrist or around your finger. There could be a tightness or a weird sensation there. That's why we restrict the amount of time that you wear the constriction loop to no more than 30 minutes. You don't want to let it snap around the base of the penis. These are all things that are going to lead to bruising or discomfort. You can go to menMD.com to view other videos. You can rewatch this. You can view earlier iterations of this presentation where maybe there were different questions or answers. Again, this is all about taking the time to invest in yourself to learn about what you're trying to do and learn what's going to benefit you. As I mentioned, don't use the constriction ring for longer than 30 minutes. And of course, talk to your doctor. There's not a ton of pharmacological contraindications, meaning medicines that you're taking that you can't use a VED with. But if you are using blood thinners, there's an increased likelihood of bruising and bleeding from the constriction loop or just from the vacuum, the lack of pressure in the vacuum chamber, sort of like pulling on the veins and arteries in the penis. There's a note about our sponsor. And with that, we'll move into the question and answer session. Okay, I hope that everyone can see me now fully on the webcam.
All right, I can see you.
Great, thank you. What do we have for questions, Austin?
All right, first question here. Do I need a prescription for a VED?
You don't need a prescription for a VED. It's an over-the-counter item, and you can simply call menMD to order a VED, and they'll talk you through the models that they have. Again, manual, vacuum, no prescription needed.
Great. Next question here. I'm having trouble with the ring transfer. Any tips on preventing the ring from sliding off the tube above the base of the penis?
So the question is the man is having an issue where with ring transfer, so getting the constriction loop off the cylinder onto the base of the penis. What was the last part of the question, Austin? There was something very specific there.
Yeah, so you're saying that it was sliding off above the base of the penis, so I guess he's trying to get it closer to the base.
Yeah, okay, so that's two things come to mind. You'd want to make sure that you're really pushing the cylinder down into your pubic area so that it's as tight down on there as you can. Again, it gets a little tough because you may need both hands to do the transfer. Some constriction loops have hooks on the side, or little pieces of the rubber that you can pull on. It is okay once it comes off, if it comes off a little too distally, a little too close to the tip of the penis. Not that it would be anywhere near the tip of the penis, but relatively, if you can pull on it and move it down, that may help. Of course, every time it's not tight around the base of the penis, you're going to be losing blood flow. So this to me is about practice. Maybe using some more lubricant down around the base of the penis, or even putting lubricant on the cylinder underneath where the constriction loop goes, so that it slips off easily, so that when you push down on the cylinder, it slips right off. That's what comes to mind in terms of tips to help you get it there. There's also different types of rings. I mean, there are adjustable rings that are like a noose. Maybe the ring that comes, maybe for you, the ring that comes along with the VED isn't perfect for whatever reason. Not that there's anything wrong with it. It may be a dexterity issue. Some patients have arthritis, a variety of reasons why that ring might not work. You could get one of these noose-like rings that you would put on your penis, put the cylinder there, and then you'd be able to sort of pull that like a noose. Maybe that's the answer. And to my knowledge, menMD sells alternate types of constriction loops also, so you could talk to someone about that.
All right, next question here. How soon after prostate surgery can you start using a VED?
That's a good question, and your surgeon probably would have very specific recommendations for that. I've seen patients start as early as a week or two after. Some surgeons prefer to delay longer than that. It would depend on specifically the type of surgery that you had. There's a few different ways to do a prostate removal. That is a question you should ask your doctor who's doing the surgery, or urologist that's following you, because you'd want them to be very, very engaged in everything that you're doing with penile rehab, whether it's the VED or medications that they're giving you to aid in blood flow after the prostatectomy. Generally, it's somewhere between a week to 4 weeks after. That's a preference of your surgeon.
All right. Does insurance or Medicare reimburse for a VED?
I don't think they do. Years ago, they used to, if you got a prescription. I As far as I know, there's no coverage for this anymore because it's considered an over-the-counter item. I believe that a few years ago, coverage for VEDs ended. So no, this is not covered. The good news is, although there's a variety of different devices and some of the devices can be very expensive, the base manual models of these devices are relatively inexpensive. So the cost, if this is something you're really motivated to do, you should be able to save up relatively easy for a device. An entry-level device is probably around $100.
All right. By using the device over a period of time, can an erection be achieved naturally without the device?
That is possible, sure. So, and again, this depends on your age and your comorbidities, the other medical conditions that you have. Did you have prostate surgery? Do you have diabetes? Is this, situational erectile dysfunction, or what we call psychogenic erectile dysfunction, where there's not really an organic problem with blood flow? It's more like in your mind, you're nervous, maybe it's a new partner. So, I can't go through every single scenario, but the goal of penile rehab is to recondition the penis so that you get better, stronger erections, either with the medicine you're using or on your own. So if a patient has very mild ED and they're just starting to lose their nocturnal erections and they notice they're having sex and maybe they don't maintain their erection the whole time, or maybe they're not getting an erection on demand all the time that they want, the earlier you are on in the process, the more mild the disease, the more likely you're going to see impact. But across the board, I would say yes, there is a possibility that you could do rehab on your penis and regain natural functioning.
All right, next question here. Can a VED be used in combination with Trimix? And if so, when should I use the VED, before or after applying the medication?
Okay, so it can. I mentioned in one of the slides, the VED can be used to augment pills or injection. And the questions were probably submitted beforehand. It's a very, very common question. When do you use the VED? So let's say you're injecting and you are not getting a full erection. So one thing that you could do is simply work with your doctor to change the dose, or your doctor probably wrote you a prescription for Trimix that allows you to increase the volume you are injecting. So one avenue would be, don't use the VED at all and continue to fine-tune the dosing of the Trimix, because most people can get to a point where they're dosing and getting a good erection just with the Trimix. And then you don't have to complicate that by adding a second modality. If that doesn't work, or for whatever reason you do want to add the VED, you could use your pills or use your Trimix, which is what this question asked about. Let's say you inject and you get a 5 out of 10, and I use this rigidity scale where 0 is no change in blood flow, 10 is a maximally rigid rock hard erection, and 6 would be just sufficient for penetration. Well, let's say you're getting a 5. Let's say that the injection of Trimix is stimulating arterial blood flow, which is good and feels good and is healthy, but it's not enough for penetration. You could absolutely put your 5 out of 10 erection, semi-erection, into the vacuum device and inflate it up to an 8 or a 9, and then use the constriction loop also. That's a very, very effective way to do this. And in many ways, that's more effective than the VED alone, because you've got arterial blood flow running into the penis, which the Trimix stimulated. Had you not used the Trimix and you just used the VED, there's no blood from your systemic circulation bombarding the base of the penis to flow into the penis. You've pulled it in with the VED and then trapped it with the constriction loop. So the moment you take the vacuum off, whatever blood escapes the constriction loop, there's this slow sort of decline in the erection. So that combination of Trimix, then the VED, if you're not achieving results with Trimix alone, is a very, very good combination. And when would you do it? You would do it at the point of, maybe 5 minutes after the injection of the Trimix, or 10 minutes after the injection of the Trimix, because everyone's onset is a little different. I mean, some men inject Trimix and you get an erection in 2 minutes. Sometimes it takes a little bit longer. So you'd want to let the Trimix begin to work, let the medicine spread around the smooth muscle and stimulate arterial inflow into the penis, then put the VED on to augment the response to the Trimix. I'll say one more thing about that. You know, sometimes guys have trouble injecting and will pump the penis up a little bit first, get a little blood flow into the penis and get a 1 or a 2 with the vacuum so that the penis is a little larger, there's a little more of a target there, and then do the injection. I was never personally a fan of that, of telling patients to do that, because I think it adds a complexity to things, but I have had patients over the years that have done that and like doing that and felt like they've had greater success. My concern is always that you use the vacuum, you get this 1 or a 2 out of 10, you know, slightly rigid, semi, you know, chubby, whatever word you want to use to describe this, slight erection, and then you're going to do the injection. And the whole time you're going to do the injection, blood is leaving your penis, flowing back into your body, and you run the risk of sort of flushing the medicine that you're injecting right out. So, you know, again, I think that if that's the situation you find yourself in, you should do some one-on-one talk with your doctor or a case manager at menMD. Most people that talk about using a VED, it's not to create a larger target for the injection, it's to augment the erection after an injection or a dose of pre-med sort of doesn't get you an erection sufficient for intercourse. Perfectly fine to do either.
All right, next question here. I have tried cheap sex shop type devices with varying results. Will a medical grade device that costs hundreds really be better?
Well, you know, in theory, these devices are all sort of built with the same idea. They're creating a vacuum around the penis to stimulate blood flow in. I'm not a fan of the sex shop devices because I found them to be cheap. Lots of times they don't have the safety mechanisms on there to allow you to deflate the penis or deflate the vacuum around the penis. There could be issues with cheapness of the rubber seal. I mean, you know, my goal here is not to get you to buy an expensive device. I don't care which one you're using. I want to help you get an erection or engage in penile rehab. But, you know, if it's not working and you're using, you know, this sort of cheap device, I can't help but think maybe there's something wrong with the device. It wasn't designed correctly, because these are a dime a dozen. You know, they come over from cheap assembly lines. So I don't know. So that adds a variable to this, that if you said to me, it's not working and I'm using this device that I got for $19 at a sex shop, I'd say, geez, maybe there's a problem with the device, because as you saw from the data, VEDs work in over 90% of men. So the data suggests the VED should work. So, you know, I would probably encourage you to get a medical grade device because it's safer for you and it was designed better and approved by the FDA or cleared by the FDA prior to being marketed. And, you know, your assertion that they're hundreds of dollars, I don't think, you know, it doesn't need to be hundreds of dollars. The base manual model, that's, I think, again, about $100, it would eliminate all of my concerns there about is the device failing you, or, you know, so that's my answer to that.
All right. Is there a role for VED therapy to limit or reduce scarring after long-term injection therapy?
I would say yes. You know, scar tissue, whether it's from repeated injections or, you know, there's a disease called Peyronie's disease, which is a formation of scar tissue in the corpus cavernosum that sometimes isn't from injections. It just happens to men naturally. The solution to minimizing that fibrosis, that scar tissue formation in the cavernosum, is stretching the tissue and oxygenating the tissue regularly. So because the VED is pulling oxygenated blood into the penis that's stretching the tissue, you know, that's going to create a healing environment. So, you know, one of the theories about why Peyronie's disease and scar tissue develops after prostate surgery, even in men who've never injected, is because of the decreased penile oxygenation that occurs. The radical prostatectomy sort of traumatizes the nerves. The condition's called neuropraxia. The surgeon sort of moves around the nerves. Even when the surgery is nerve sparing, they still manipulate the nerves to remove the prostate because it's such a heavily innervated area. And that neuropraxia leads to the subsequent erectile dysfunction, which lasts up to 6 months. And then, sometimes men after 6 months will then go to use injection therapy. It's their first injection and they get an erection and it curves a little bit. And they say, oh, geez, I injected and I have scar tissue. Well, one injection didn't give you scar tissue. That scar tissue was forming slowly over the 6 months since your surgery because of the deoxygenation in the penis that was occurring day by day by day. So, you're not talking here necessarily about deoxygenation. Maybe you are, because the bigger question is, are you getting scar tissue actually from the needle, or is it simply some type of deoxygenated state in the penis? We'll never know for sure. Either way, there's no harm and there's value in stretching the penile tissue and getting oxygenated blood into the penis. So I would say, to go back to my analogy about breaking your ankle and doing physical therapy, the physical therapy helps the underlying physiological state of the organ or joint that you're trying to help. So penile rehab using a VED, I would say there's a strong potential that it's going to help minimize scar tissue formation or reduce scar tissue that has formed from injections, yes.
All right. Next question here. How do I ensure a good seal without shaving or buzzing down the hair around the seal?
So you don't want to shave, right? The hair can, of course, get in the way of creating a tight seal. It's about the pressure that you put on the cylinder against the base of the penis, and it's about using enough lubricant in there to create a tight seal. This is strictly a mechanical process of creating enough pressure and putting enough lubricant there to create the seal. That's there's no magic or secret to that. It's about just trying over and over again. And again, don't be afraid to push the cylinder against the base of your penis. As you begin to create the vacuum, some of that, the skin from the penile fat pad there around the base of your penis underneath the pubic hair should begin to be sucked up a little bit into the cylinder, and that should also help create a seal. So maybe you need additional pressure just for a minute while you're beginning to create the vacuum, and then you can loosen up a little bit on how much you're pushing the cylinder into the base of your penis. Hope that helps.
All right, next question here. I lose my erection after a couple of minutes with the largest constriction ring. Will a smaller ring work better?
I would think it would, yes. So I was using my arm here to describe sort of a rigid erection and the erection fading. So when you have your penis in the cylinder and you've stimulated it maximally and got a good vacuum there, and then you snap the constriction loop off, it creates a seal here around the base of the penis. You release the vacuum, and then again, because there's no arterial inflow, there's no blood coming this way into the penis, it really is this slow loss because blood is leaking out. So if you find that you're losing the erection too quickly, it's because this constriction loop is not tight enough. So using a smaller loop would be helpful. This is one of the areas where you've got to be reasonable, though, right? Like you don't want to put something around the base of the penis that's so tight that you damage your penis, and you don't want to wear the loop for any longer than 30 minutes. So stepping down one size and using a smaller size and seeing if that makes a difference is certainly a viable strategy. If you're losing the erection as you described, you should be able to find a loop that's tight enough that allows you to maintain a rigid erection for longer than 3 to 5 minutes. And if your device, some of them come with different sizes, some of them don't. Again, there's that noose-like device. There's a variety of different loops that you could try to help you get to success with this. So maybe your purchase comes with 3 different sizes. I don't know, I'm sort of guessing here. And maybe none of those work, and that's because your penis is too large or too small or whatever the case may be based on your anatomy. That's not the end of the road. There's different things like the adjustable ones that you can try that maybe allow you to pinpoint the tension a little bit more specifically based on your anatomy.
All right. Next question here. Does using the vacuum device restore size from shrinkage, or will it just maintain currently?
So penile rehab in general will the goal is hopefully you're starting penile rehab prior to size loss. So I'll use prostate surgery as just one example. You have prostate surgery and there's that neuropraxia that I described that can lead to scar tissue formation. That also leads to size loss in many men. Men lose up to 1 inch in the length of their penis after prostate surgery. And it's not just prostate surgery. I mean, maybe you have diabetes and you've stopped getting nocturnal erections. In that case, it doesn't happen over 6 months, but maybe you sort of wake up one day and you're 70 years old and you think, geez, my penis is not the size that it was 10 years ago. You're just seeing a sort of slower loss of penile tissue. It's sort of use it or lose it, right? Just like your bicep. You stop going to the gym and lifting weights, your bicep's going to get smaller. So the question then, I sort of just gave you a little bit of foundation about penile size loss. The question is, if I use a VED for penile rehab, can I regain lost size, or does it simply stop ongoing size loss? I think it's both of those things. I think that, you know, I have had patients use injection therapy, use gel therapy. When they engage in a routine course of penile rehab, they have regained size. And I would say the method sort of doesn't matter, whether it's regular injections, daily intraurethral gel therapy, regular erections from Viagra or Cialis, VED, or some combination of all of the above. I would say my position is that regular engagement, regular use of penile rehab will help you can help you regain penile size. Doesn't work for everyone. I'd say it works for more patients than it doesn't. Your penis is, let me add one more thing. I mean, your penis is never going to be bigger than what Mother Nature gave you, what you were born with. So you can engage in penile rehab because you want to get your penis to be 1 inch longer than it ever was. That's sort of dangerous and not recommended. But if you've lost 1 inch because of one of these mechanisms that I described before, penile rehab is going to help you regain that size, yes. But it's also not overnight. You know, this is like people dieting and saying, well, I've been eating healthy for 3 hours. Why am I still fat? Well, you know, it's about you got to do this in a dedicated way over time, like learning to ride a bike, like going to the gym to lose weight, like changing your eating to lose weight. I mean, penile rehab could take months for you to regain penile size that has been lost.
All right. Next question here. If the VED does not have a pressure gauge, can you damage the penis with too much vacuum? Also, what should be the stopping point?
So I don't think it's common for devices to have a pressure gauge, but you know, I haven't seen every single device that exists. But in my experience, a gauge on there is more uncommon than common. This is why I make the recommendations to pump 3 times and wait 10 seconds, or depress the button for 5 seconds and wait 10 seconds. You're using your penis as a sort of surrogate for the pressure gauge. So, you know, if your penis is not inflated maximally and you don't have a fully rigid erection, then it's okay to add more pressure. You know, you want to inflate till you get to like this 8 out of 10 rigidity, and that's your sign. Your penis is the pressure gauge. So do it slowly, add a little bit of pressure, wait 10 seconds, add a little bit of more pressure, wait 10 seconds, add a little bit more pressure, wait 10 seconds, and then your penis is sort of growing and engorging as you're creating that vacuum. So in the absence of a pressure gauge, your penis is sort of doing that role for you. You know, if you're up at an 8 out of 10, a 9 out of 10, a 10 out of 10, and you're thinking, geez, is this my maximally rigid erection? You need to just be honest with yourself. Like, you know, when you have a maximally rigid erection, and, you know, let's not push it here. You're not trying to get an 11 out of 10 and then damage the vessels even further and worsen the erectile dysfunction. Use the tool the way it was meant to get, let's say, this 8 out of 10, and then stop, deflate the penis. Get the 8 out of 10, put the loop on, have intercourse. You know, that's my recommendation.
All right. Will a VED help someone that has little or no reaction to pills?
It will, it should, yes, because the VED is, again, this mechanical process where, you know, your body, in response to being in the vacuum, is going to send blood in there. It's just what's going to happen. pills or injections, those depend on your circulatory system, your internal vasculature responding. So you take pills and a chemical reaction has to occur. You need sexy thoughts in your mind for Viagra and Cialis in order to get an erection. And so that can be complicated by maybe you're anxious, maybe you're not horny, maybe you have high blood pressure. So there's myriad factors that can interfere with the pill working. Injection takes a little bit of that away, because injection, you don't need the sexy thoughts. You could do an injection of Trimix or Bimix and sit and watch Wheel of Fortune and get an erection because of the way they work. But still, you need a certain patency to your circulatory system and the penile vasculature in order to get the blood flowing there. Further complicated by the fact that there's that lock mechanism. You need to stop the venous leak. So when pills, long story short, when pills or injections don't work, will the VED work? Yes, it will.
All right. If my testosterone is very low, will a VED work? So I guess it's actually kind of a similar question.
Yeah, similar question, different drug though. Great question. It will. It will. So testosterone in and of itself, testosterone is like gas on a fire when we think about an erection. A man who has erectile dysfunction may have low testosterone. There are men who have normal testosterone that may also have erectile dysfunction. Correcting someone's testosterone level may make it easier for them to get an erection, but testosterone in and of itself is not really a treatment for erectile dysfunction. The mechanical nature of the VED will allow your body to respond with low testosterone levels. Absolutely.
All right. Next question here. I'm getting uneven swelling with my VED. Am I pumping too fast?
Uneven swelling with my VED. It could be that you're not waiting. You've got to inflate and then wait a couple of seconds for the blood to fill the penis. There also could be anatomical changes. This could have something to do with your particular health situation. Did you have prostate surgery? Is there scar tissue in the penis? When is the last time you saw a natural erection? If it's been years, maybe some changes have occurred to the penile architecture that makes your penis look different now than you remember. I would say go slower, deflate the penis. Maybe you take the cylinder off and squeeze the penis to move that blood around, and then put it back on and pump it again. This is something that should be overcome though with practice. I've heard this before when men are just getting started. I haven't had an erection in 10 years, and then I put the VED on and I try to get an erection and my penis sort of swells funny. Well, that's sort of venous and arterial dysfunction. The architecture of the circulatory system of the penis is sort of not used to that increased blood flow. So I go back to my analogy of physical therapy on your ankle. You would sort of engage slowly, and regularly to overcome that. That should work. And if that doesn't work, then you should have a more detailed conversation with your doctor. I would be curious, does that also happen when you use Viagra or Cialis? Does that also happen when you do injection therapy? Those are some of the things that we would do to try to differentially figure out what's causing this problem.
All right, next question here. If the patient is currently on a clinical trial, still taking chemo medications, can this device be used?
Okay, so that's a tough question because there's sort of two things in there. One is clinical trial, two is cancer chemotherapy. So I'm going to assume they're related. We could unpack that question and say, well, I'm in a clinical trial, not for cancer, can I use a VED? Another question could be, well, I have cancer and I'm using chemotherapy, can I use a VED? You sort of combine them to make this question even harder, which is, I'm using cancer chemotherapy as part of a clinical trial, can I use the VED? Probably. Again, there's very few medicines that are contraindicated, that the VED is contraindicated with. I don't know what type of cancer you're treating. Maybe it's obvious that it's prostate cancer or something, but you could be talking about lymphoma. I just don't know from the question. I don't know anything about the medicine that you're being given in the clinical trial. Is this a medicine that could affect vascularity, or is it blood thinning? You know, I'm sorry to say there's just sort of too many unknowns there for me to answer. The likely answer is that you probably can. I mean, men inject Trimex while they're on chemotherapy and having prostate cancer while they're going through radiation. It's probably yes, but there's too many unknowns for me to know. So just ask your doctor that, the chemo doctor or the clinical trial doctor, and I'm sure that they'll be able to give you an answer. Talk to your urologist. I'm sorry.
All right. What should I do about extreme discomfort due to semen blockage by the constriction band?
Extreme discomfort from semen blockage. So, you know, if the constriction loop is too tight and you reach the point of orgasm, climax, and the vas deferens and all of the testicular architecture is starting to contract to expel semen from the penis, you know, there shouldn't be tremendous discomfort. I mean, you know, if you ever were about to ejaculate and sort of squeezed your penis to stop it from coming out, there's this moment of discomfort, but then, you know, everything relaxes and you go back to, most typically you go back to sort of not being uncomfortable. So there's something about your question that concerns me, like if this happens and then you're in pain for 30 minutes, you know, that feels like there's something else going on there. Maybe you've misattributed that to semen blockage and there's some other issue that would need, you know, you'd need to have a physical exam to figure out. The other possibility, you know, is it possible for you to stop penetration or stop whatever stimulating activity you're doing, or just when you get to that moment where you're about to orgasm, remove the constriction loop to sort of circumvent that whole problem. You know, there may be reasons why that's not what you want to do, but part of this is about adapting to the new situation. You know, the penis doesn't have to be maximally rigid to have an orgasm. In fact, you know, men who have prostate surgery or have erectile dysfunction from whatever cause, and that don't use Trimix or Bimix, that don't do any type of oral therapy or penile rehab, you get a point, like Mother Nature finds a way. You know, these men reach a point where you can stimulate your entirely flaccid penis and have an orgasm. So, you know, I offer that to you, and that may not be the ideal situation, but that's a fact. Maybe there's a way for you to have a satisfying sexual encounter and then remove the constriction loop 10 seconds prior to orgasm so that the semen blockage from urethral constriction does not occur. If the pain is sort of severe and you're saying sort of what else can be done, if you're having discomfort that's anything more than, say, you know, 30 seconds after the moment of climax and the outflow of semen is blocked, I would talk to your doctor.
All right, got a few more questions here. What type of lubricants do you recommend for VEDs?
I have no, you know, there's no clinical data that sort of offers any type of preference. I don't have a recommendation. That feels like a personal patient choice based on the way you like the lube to feel, the way your partner likes the lube to feel. You know, some of the lube that comes with the VEDs to put around the base may be a little thicker because you're trying to create a tight seal. So maybe that lubricant to create a seal is not the same lubricant that you would use for sexual activity. That's sort of the only piece of advice that I have, is if there's a thicker jelly-like lubricant, that may work better at the base of the penis for creating the seal, and that may not be the type of lubricant that you want to use for sexual activity. So it's about the viscosity and the thickness of the lubricant in terms of creating a seal.
All right, last question here. How long should a VED device last?
Oh, you know, that's you know, how good is the engineering of a manufactured device? You know, that's like asking how long should my toaster last or my TV last. I mean, these things are built with an expectation that you're going to be able to use them for years and years and years. I would imagine a VED comes with at least a 1-year warranty from the manufacturer. I'm totally speculating here. I feel like a 1-year warranty is very common on manufactured devices, again, whether it's TV, toaster, washing machine, VED, I think everyone's expectation from the manufacturer to the consumer is that, you know, your washing machine doesn't break on day 366 after you purchase it. That's not what I would expect from the VED either. Could that happen? Does that happen? Sure. Again, even though this is a mass-produced, highly replicable item where you think there would be consistency in the quality, you know, I'm sure that people have had devices break early and devices break, you know, after 10 years. I think that you're going to buy a VED, and the expectation is that it's going to work, you know, for many, many years. You know, situational outliers or sort of rough usage, you know, excluded from that.
All right, so that was the last question there. So with that, I'd like to thank Patrick for taking the time to present today. And we'd also like to thank everyone listening in for attending this menMD Real Talk webinar. We hope it was informative, and you'll join us again in the future. If you'd like to learn more about VEDs, you have a few options. There are more resources in the Resource Center on menMD.com. You can visit this page to view instructional videos, guides, expert articles, and more. You can also call menMD at 857-233-5837 or log in to the password-protected secure menMD portal to schedule an appointment with a clinical case manager at menMD. If you're interested in purchasing a VED or checking out the pricing for our VEDs, you can do so on the shop page in the menMD portal or by calling into our office at 857-233-5837. We'll also be sending a follow-up email with references to helpful resources and links to each after the event. But with that, I'd like to thank everyone again for attending today's webinar, and we'll see you at the next one.
Thanks so much, everybody. Appreciate it.